Hello, my name is Amit Pawa and this is a short video on the anterior femoral cutaneous nerves. I have a few disclosures, but none of which will impact on my ability to deliver this short video, other than to say, when we talked about knee arthroplasty analgesia options on our Block It Like It's Hot podcast, Jeff Gazin mentioned the Cuties, and he wasn't referring to the two of us, he was referring to the anterior femoral cutaneous nerves, and that's what's inspired me to deliver this short video. So the outline is I want to talk about what the indications are for anterior femoral cutaneous nerve blockade. We'll briefly cover the innervation of the knee, and then we'll give you some scanning tips, and I will show you a block. So what are the indications for anterior femoral cutaneous nerve block? Well, as I mentioned, you can use it as part of your package for total knee arthroplasty regional anesthesia, or you might simply want to use the QT block for anything where you require analgesia to the anterior aspect of the thigh, or in combination with a lateral femoral cutaneous nerve for anterolateral thigh analgesia. Let's take a little bit more of a closer look at the cutaneous innervation that is provided by the anterior femoral cutaneous nerves. So if I draw on over here, this is kind of the sort of appearance of where the anterior femoral cutaneous nerve branches lie, and they're associated with this sort of dermatomal coverage. Now, the anterior femoral cutaneous nerve has two main branches, the intermediate and the medial branches. So the anterior femoral cutaneous nerve branches into the intermediate femoral cutaneous nerve and the medial femoral cutaneous nerve. And if I superimpose the dermatomal coverage from the lateral femoral cutaneous nerve here, you can see how these cutaneous nerves can actually be responsible for a large part of thigh analgesia. Now, this slightly busy looking slide is going to come from another video I'm going to do on the full innervation of the knee, but you can see I already have demonstrated in here the genicular nerves and also other branches of the femoral nerve, the nerve to vastus intermedius, lateralis, medialis, and the saphenous nerve branches. If we superimpose the anterior femoral cutaneous nerve, intermediate and medial branches, you can see how these now contribute to that jigsaw puzzle that is innervation of the knee. So how do we find the correct injection point? Well, what we need to do is to start off by placing our probe in the middle of the thigh, slide medial, and then move cephalad and caudad as you start to identify the apex of the femoral triangle. That just gives you a reference point. When you're doing that, you then want to look into the fascia above sartorius. So what does that process look like? Well, here you go. Here is the probe placed in the mid-thigh. I'm going to slide up and down now, starting to see adductor longus come into point there, and the point at which the medial border of adductor longus and the medial border of sartorius meet, that is classically described as the apex of the femoral triangle. If we superimpose those labels there, you can see you've got the yellow showing the adipose and the fascia above the sartorius muscle. You've got all the muscles and the vessels indicated there, and that point, that medial meeting point there, is the apex of the femoral triangle. So once you've got yourself orientated over there, how might you then focus your attention in the correct plane? Well, here again, this is a probe placed in a slightly different position on the thigh. You can see I've highlighted in green the area where you want to focus your attention. And when I remove the labels in a second, you'll appreciate the probe is sliding up and down the leg, and we want to look in that area where the green highlights are for these QT branches. So let's have a look at that. So remove the colour, watch that finger there, and it's going to start to focus on a relatively consistent structure that's floating up and down in that area just above sartorius. Now clearly there are a few branches there, but I'm focusing on the largest one there just to focus your attention. So as we're sliding up and down the thigh, you can see with that probe there, you're looking for something lying in the fascia above sartorius, and that is one of the branches of the anterior femoral cutaneous nerve. And clearly, all we want to do is to deposit local anesthetic in that layer above sartorius. What does that look like in a real patient? Well, I'm going to show you. This is a patient where the image now has been focused on the area just above sartorius. Sartorius is lying underneath the label where it says anterior femoral cutaneous branches. I'm going to play the video now, and as we're scanning up and down, we're looking in that fascia above the muscle. We're looking for a structure to kind of come together with just a branch coming off there. So we're aiming for something right in the center of the screen. Now the needle is going to approach here, and you may want to watch the video a few times back to actually see that, identify that structure. But as the needle comes in here, it's going to pop into that fascial layer and just pop some local anesthetic around that anterior femoral cutaneous nerve branch. As we're injecting, you can see the nerve moving away, and now we're going to scan up and down to see a nerve separate into branches there and come back together. That's literally as simple as it is. So when you're doing that, what are our medication options? Well, for this type of block, you just need between 3 to 5 mils of local anaesthetic under ultrasound guidance. And we've got the choices of using levobupivacaine, bupivacaine, or ropivacaine in simple terms. So that's it. So in summary, scan as if you were looking for a femoral triangle block. Identify the fascia above sartorius, slide the probe caudad and cephalad until you identify those cuties, and then infiltrate that area with 3 to 5 mils of local anaesthetic. I hope you found this video useful.